Chicago Tonight, Latino Voices is made possible in part by Allstate and the Searle Funds at the Chicago Community Trust.
Good evening y bienvenidos to Chicago Tonight Latino Voices. I'm Alex Hernandez of Univision Chicago Primera Hora, which airs every weekday morning at 5 and 6. Thank you for sharing part of your weekend with us. On the show tonight, COVID vaccinations for kids 5 and up are on their way and antiviral treatments are on the horizon. We talk with local medical professionals about the latest developments. Exploring identity through photography, we take you to a new exhibit in River North. Learn more about a federal program that seeks to help struggling households afford broadband internet access. A local theater explores themes of immigration and identity in their first stage production in 18 months.
Taking that one step can lead to so much change within your life.
And a teen activist in Hinsdale gives La Ultima Palabra on the emotion she says prevents many people from standing up to their communities. First off tonight, as we approach the end of the second pandemic year, the outlook for the months ahead remains in flux. 2 antiviral treatments for existing COVID-19 infections are on the horizon. And in Chicago, more than 6,000 children ages 5 to 11 received COVID-19 vaccinations this past week. But with case counts once again on the rise and holiday gatherings just around the corner, the threat of COVID-19 still remains high. Here to break down the latest developments are Dr. YESSENIA Castro, a pediatric hospitalist and assistant professor of pediatrics at Loyola University Medical Center, and Dr. Geraldine Luna, medical director at the Chicago Department of Public Health. Thank you both for joining us today. And I want to start with you, Dr. Luna. Have parents been hesitant to get their kids vaccinated?
Well, it's very soon, right, in our rollout vaccination, but we kind of see that we are already seeing a little bit of that disparities. Only 3.9% of our population eligible 5 to 11 have received 1 dose of the vaccine. But within that, we started noticing that African American communities and Latino have the lowest percentage, meaning 2 for Latin Americans, Latinx, and 1% for African Americans. Our white population already has 10% of their vaccination, of this group that has already gotten the vaccination, already vaccinated. And then Asian follows with 5%. It's very early. We don't want to, say that it's a predictor.
Right.
We saw that our clinics are now like completely full for the following 3 weekends. So that is very exciting. Our clinics are mainly located in those communities more highly hit, people of color, where we've seen the lower vaccination rates. But we hope that the culture around vaccine changes, and it's not a reflection of what we have seen in terms of our ethnicities getting vaccinated, because there are disparities there with the adults.
And Dr. Castro, are there any risks associated with the COVID-19 vaccination for kids? What are the long-term risks for children who contract COVID-19?
Well, as a pediatric hospitalist, I've seen the children who have come in to the hospital with acute COVID or multisystemic inflammatory syndrome, which are some risk factors to having COVID-19. And we certainly want to prevent those serious hospitalizations for the children who contracted COVID-19 with the vaccine.
Now, I'm going to remain with you, Dr. Castro, because in Virginia, there were reports of pharmacies administering 1/3 of the adult-sized vaccine doses to children, meaning they may not have received the proper dosage. How can parents be sure their kids are getting the right dose?
Sure. So we have already had our training in pediatrics in Illinois for vaccine distribution, and the vial comes in a different color. It's an orange vial. And if you are concerned, you can certainly ask the physician or the provider who is giving the vaccine you could look at the vial, make sure it's the orange vial, which is the correct dosage for the child.
Dr. Luna, what advice do you have for people making holiday plans, for example, to visit family who might not be vaccinated?
Well, the important thing for our population to take into account is that vaccination is the safest way to go. So if you're completely a family that it's 100% vaccinated, you can gather with other families without limiting that the individuals participating in that group and those gatherings. So it's important if we're deciding not to do it on a vaccinated way, remember, keep the ventilation in the room as much as possible. Use masks if you can't have like a safe distance, especially if you have 65 years and older that are not vaccinated. Any people with, or any person with any diseases that put them at risk, or children that are not within the eligible group, or those that have not been vaccinated. It's important. The risk is always there if we're gathering and we have unvaccinated individuals around us. So I would highly, highly recommend, if you're planning to sit down in Thanksgiving and you want to have your family, as you should, get the vaccine right now. Johnson & Johnson puts you up front in the career right now if you get it. Or if you opt for Pfizer or Moderna, you'll be partially protected, which is better than no protection at all. And for December, for sure, if you start your vaccination series right now, you will be completely covered in December. Podemos celebrar en familia como nos gusta, en diversidad, celebrating humanities. This is who we are. We're a social group. Latinos love parties, and why not? We just need to get completely vaccinated and leave this pandemic behind. We can do this.
Let's talk about something that also might help us get out of the pandemic. I'm talking about the antiviral pills. They are on the way to treat existing cases of COVID-19. Can you explain, Dr. Luna, what those are and when we might see them available and see them in practice in hospitals and clinics?
So those are exciting news, but it's important that people understand that they're not the replacement for the vaccine. Vaccines prevent disease from happening. These pills will certainly help shorten the severity of the disease, hospitalizations, and death. So we have Merck right now with molnupiravir. I hope I'm saying it correctly. It's 50%, has shown 50% efficacy, taking 5 days after the initiation of symptoms, and with the certainty that it did decrease hospitalizations and it did decrease death related to COVID-19. So those are antivirals that avoid or halt the replication of the virus. And the other one coming next, which hasn't submitted the paper, so we hope to have Merck probably by the first week of December already out there, helping our people already having the disease to keep them out of the hospital. And then for Pfizer, we have our other, which is, it's the same efficacy, is the same technology, a kind of antiretroviral, halting the replication in the body. Again, you take it 5 days after the symptoms have started, and then you can see the magic coming in, shorting severity, shorting hospitalizations. And this one was with 89% efficacy.
Wow, that's great.
So those are excellent medications to keep people out of the hospital.
And we'll be following up with that.
Infection has set in.
Definitely. And last, Dr. Castro, I want to end this with you. We have less than a minute. Cases are on the rise again with winter approaching. Do you anticipate the child vaccinations will help bring those numbers down?
I do, if more children get vaccinated, particularly this weekend. My 2 little girls got vaccinated yesterday in the hopes that they have some protection coming in towards Thanksgiving. 3 weeks from now, their second dose, and a few weeks after that, full immunity. So we're really excited about celebrating Christmas with the whole family. And I hope that other parents can trust in the vaccine the way us science moms are super excited about it.
Definitely.
And vaccinating our kids so we can celebrate the holidays the way we love.
Let's hope that's the case. I want to thank both of you, Dr. Castro and Dr. Luna, for joining us today.
Thank you for having
us. Thank you.
There's a citywide exhibition featuring 29 MacArthur Fellows in 12 galleries. One particular exhibit at the Weinberg Newton Gallery in River North is exploring what it means to be Latino in Chicago. Arts correspondent Angeli Du shares how the artist's explorations of culture through history and photography reveal how the Latino story is the American story.
Thought about your words, and then I looked at the pictures.
For decades, Wendy Ewald has always found the best method of storytelling to be through photography and with the help of children.
I started sort of my work in that way because I was very interested in
their freshness and their honesty.
During the pandemic and this past summer, she worked with students from the Centro Romero Youth Program virtually to use photography in an attempt to capture what it's like to be a first-generation Latino in Chicago. It's a part of the social change series titled Daily Life and Dreams in the Pandemic.
They bridged their parents' experience and their own experience.
Now, one of those stories includes 18-year-old ADRIANA. She tells her mother's story of moving to the United States alone at just 15 years old.
I think it's really important to tell her story because I think there's just this stereotype that they come here for the wrong reason. It's absolutely necessary for them to come over here and make money to support their family. And for her to be able to do that at such a young age and take responsibility, it's something that it takes a lot of guts. And I'm glad that her story is being shown and that I'm part of it.
Oh, is this your mom up here?
Yes.
NAILA documented what it was like growing up in a Latino and Asian household. Her parents are from Mexico and Laos.
Mostly the Day of the Dead, we wear like shirts or dresses that have flowers on them and like are really bright colors. And my dad's part of the family, we have like skirts that have different kind of patterns and designs.
The exhibit also features work by AMALIA MESA-BAINS called Dos Mundos, which explores her family's immigration story to Chicago in the early 20th century.
My family had worked in the steel mills and the packing plants and started thinking about the office building downtown and realizing Mexican people worked in the steel mills that built those. And so they're kind of an invisible infrastructure in the city.
Even though the stories explored in this exhibit sit decades apart, the artists are united in the hope that everyone can see themselves in their work.
It's just normal families just trying to live their life like anybody else.
The thing that I think makes our show, a two-person show, really balance out is I'm talking about a wave of immigrants 100 years ago and the community they began. She's talking about contemporary current issues, how those young people see themselves, and that's our job. Our job as artists, we create imagery, we create words through poetry, dance, theater. Our job is really to uplift young people.
Thanks.
For Chicago Tonight, I'm Angel Ito.
The exhibit is called Toward Common Cause, Art, Social Change, and the MacArthur Fellows Program. You can check out the exhibit through December 18th at the Weinbach Newton Gallery in River North. And you can visit our website for more information on exhibits by other featured MacArthur Fellows. Up next, are you struggling to afford broadband internet access? Details on a new program to help with costs. Stay with us. For the last 2 years, stay-at-home orders and closed schools made people's reliance on the internet more apparent than ever. It also showcased the inequities in access to broadband internet. According to 2020 census data, 17% of Illinois households do not have broadband access, cutting them off from things like paying the bills, accessing educational resources, and applying for jobs. Nationwide, Latino households are not only less likely to have broadband access, but also the devices needed to get connected. That's why the Federal Communications Commission program called Emergency Broadband Benefit, EBB, seeks to close that gap. Joining us now with more are Angie Cooper, Chief Program Officer for Heartland Forward, an Arkansas-based think tank that advocates for policies aimed at boosting the economy in the region, and Caroline Sanchez-Crozier, National Innovation and Technology Committee Chair for the League of United Latin American Citizens, LULAC. Both of you, thank you so much for joining us today. Let's get started, and I want to start with you, Caroline Sanchez. Can you explain the benefits of this program, and why do you think it's necessary?
Okay, the benefits of this program are to really bring support to families that are not connected, and one of the main reasons is the cost. So this benefit will help them address the cost issues, and that's a first in addressing the digital divide.
We're actually looking at the graphic right now saying that it could save $50 per month discount for broadband service, up to $100 on a one-time discount to purchase device, and continues until funding runs out for 6 months after pandemic ends. So this is great. Angie, who is eligible for this program?
Yeah, so the FCC has outlined eligibility. So to go and find if you're eligible, you can either call 833-511-0311. The eligibility is based on a few different criteria. So it is outlined very similar to other federal programs. So think about things that eligible households that are on SNAP and WIC, eligible households that receive free and reduced lunch, and other criteria that is outlined for who is eligible for each community.
And especially, we know Latinos and the African American community will greatly benefit from this program. Caroline, going back with you, what are the barriers to access, and how does this program address them?
Okay, so besides the cost, the barriers are many times the language. It's not easy to navigate getting enrolled and in finding the different options for different providers. That's one. The other is the just the literacy, being literate and understanding the different offerings and the benefits that having the internet can provide. So this will provide addressing the cost, but then LULAC is going to be available to help in all the other steps that it takes to not only get the internet but use it effectively for your work, for learning, for health, many things that happen after the pandemic that are now essential to be digitally connected.
That's a great point that you bring, because digital literacy programs are important. So Angie, I want to ask you as well, are there programs available for participants once they get connected?
Yeah, so one of the exciting things between Heartland Forward and LULAC is we are partnering to ensure that communication gets out to the Latinx community on how to, one, sign up for the emergency broadband benefit, but also once you find out if you're eligible, how do you go through the process to sign up? And if you are lacking some of those digital skills, understanding everything from who is your service provider, how does the device get connected to my home? It's going to take on-the-ground partnerships with organizations like Heartland Forward and LULAC to be able to provide that information. And we're just thrilled to be partnering with LULAC as we build out the programmatic efforts and get information out to the households that are eligible. Everyone deserves access to high-speed internet. We know it's an economic issue, and it's in the 21st century, people should not be lacking that access.
Right, and I know you mentioned it earlier, Angie, but I want to ask you again, Caroline, if you can repeat, how can people apply for this program?
Well, there's a number. Of course, you can also go online, but if they're not online, they're not going to be able to do that way.
Right.
So the number is to call is 833-511-0311. And also the partnership that LULAC and Heartland has is to assist, and we'll be providing workshops to our councils across the state, and we'll be walking them through the process. So it really is as easy as calling the number, and then we will be having outreach mechanisms and workshops so that we can walk them through the process.
Angie, how do you think this can help the economic outlook for Midwestern Latino communities? We have less than 30 seconds.
Yeah, this is an economic issue. It impacts how you search for a job, train for a job, do a job. It impacts healthcare, education, and truly the overall economic success of our community. So again, we're thrilled to be partnering with LULAC and look forward to staying connected and making sure households that are eligible get signed up for EBB.
Great. Well, thank you, both of you, and let's hope more and more people get this great benefit and get connected. Thank you both.
Thank you. Thank you.
Aguijón Theater of the Chicago Belmont-Cragen neighborhood on the Northwest Side has kicked off its 21st season with its first stage production since halting operations due to the pandemic. La Gran Tirana explored the idea of immigrant identity as it follows the journey of Ana Morgana, an immigrant who transcends her own reality by imagining herself to be the Cuban diva La Lupe. Aguijón Theater co-artistic director and managing director Marcela Muñoz says the two-person show is a love letter to the music of the Caribbean.
It is based on the life of La Lupe, who was this amazing Cuban singer and very, very famous in Cuba. And then she moved to the United States, to New York, left her country, left her fame there, and then became quite as famous here too.
Cuando tú te hayas ido, me envolverán las sombras.
But one of the things that Rey Andújar, our writer, and Sandor Menendez, who is a director and also creator of this whole performance concept, is the idea of exploring not just her life and all of these amazing stories of her biography, but the artist as an immigrant, and how artists and in general immigrants and really all of us find ourselves in our art. Ana Santos, who is a magnificent singer and actress. She is part of our ensemble. Sandor Menendez, who directed it, as I mentioned before, and also stars in it, are also fantastic. And they just really play off of each other because they have developed it for quite a few years now and have worked together before. I think it has just, really come to fruition in a beautiful, powerful way.
La Gran Tirana runs at the Aguijón Theater through November 21st, including some free performances. You'll find more information on our website. At 17 years old, Hinsdale Central High School senior Alexandra Collins is already an accomplished environmental activist. In 2018, she founded a nonprofit group fighting to ban the emission of the carcinogenic gas ethylene oxide near schools and homes. Her activism helped prompt the closure of a medical instrument sterilization company that had emitted ethylene oxide into her community's air for 30 years. Here, she gives La Ultima Palabra on the emotion she says stops many people from creating change in their communities and how you can stop it from stopping you.
My name is Alexandra Collins. I am a high school student from Illinois, and I'm also a very proud Latina. I'm also the co-founder and director of Students Against Ethylene Oxide, SATO for short. Students Against Ethylene Oxide is the only completely student-run, not-for-profit fighting against cancer-causing ethylene oxide emissions near schools. My environmental activist work has taught me one very important lesson. I learned that in order to take action, we must not be embarrassed. I came to this realization a few years ago while I was attending an EPA forum. I remember going up to the microphone and asking one of the government doctors what measures students should be taking in order to avoid getting cancer caused by ethylene oxide. And her response will forever be ingrained in my head. She told me that students shouldn't smoke in order to avoid getting cancer. Her response was not only flippant, but it completely stereotyped teenagers, making it seem that we couldn't become activists, we couldn't become people who fought to protect our health. And I was frankly embarrassed. Honestly, being a Latina and a teenager, I didn't look like most people in that room. I was embarrassed because I felt like my question wasn't valid. But upon further reflection, I realized there was no reason for me to be embarrassed. My own health was being impacted because of ethylene oxide. And so I had every right to take my own health within my own hands. And so I committed myself to not being embarrassed. And that changed my life so much. Because I was not embarrassed, I was able to explore new things. I was able to explore this idea of activism. Now, I encourage all of you to dedicate yourselves to not being embarrassed. Reflect on times in which you find embarrassment creeping in. We need to make sure that because we live together in this world, we fight together in this world. We should support each other. Don't be embarrassed, because taking that one step can lead to so much change within your life.
In honor of her activism work, Alexandra Collins was one of this year's recipients of the Gloria Barrón Prize for Young Heroes, a national award that celebrates youth services leaders making change in their communities. You can find more of her work and see more in La Ultima Palabra series on our website. Well, that's going to be our show for this weekend. If you're watching us on Saturday night, know that you can also catch Latino Voices and Black Voices on Sundays beginning at 10 p.m. And don't forget to tune in to Primera Hora on Univision Chicago every weekday morning at 5 and 6. I'll be waiting for you. Next week on Latino Voices, Araceli Gomez Aldaña with WBEC will be here in the host chair. Now, for all of us here at Chicago Tonight Latino Voices, I'm Alex Hernandez. Thank you for sharing part of your weekend with us. Stay healthy, stay safe. Buenas noches.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, a personal injury law firm pleased to give back to the community through numerous charitable initiatives.